Healthcare workers at the University of Utah's hospitals and clinics have formed Utah Health Workers United, the state's first healthcare system-specific union. Utah isn't considered an anti-union state, but public employers are not required to negotiate a contract or even recognize a union. Utah is a right-to-work state, and the law only says that employment cannot be denied or abridged based on participation in a union. So what exactly is this new union asking for? Demand number one is better pay. The union is asking that staffers make a livable wage for the increasing cost of living in Utah. The union specifically looked at a university hospital in Portland, which has a similar cost of living and has a nurses union, and found that after a contract with a nurses union was approved, the starting wage for a nurse there is now $53.50 an hour. At the U's hospital, it's $32 an hour. And demand number two is more staffing. One member said in his unit there's typically a ratio of one nurse per 10 patients. The U's healthcare system works on a just-in-time staffing system meant to have as few workers per shift as needed. The union doesn't have specific staffing ratios in mind yet, but is pushing for this because it's necessary to improve patient health outcomes. So what happens next? Utah Health Workers United is calling for immediate actions by the university to address concerns. And while it doesn't have a specific time frame nor demand, members are planning on meeting to talk priorities.